Hi, I'm Raymar B. Calyado from Section Weidenbach. For this video, I will perform donning and doffing of PPE. But first, what is donning and doffing of PPE? The process of putting on and putting off personal protective equipment. And for the assessment, assess and ensure the size of gowns and gloves to be used, assess the need for assistance of another healthcare personnel, and for the objective, to provide proper protection for the healthcare workers in the event of exposure to highly contagious and communicable disease. And for the equipment used for this procedure are surgical cap, surgical mask or N95, isolation gown, gloves, proper size, and goggles or facials.
Identify and gather the proper PPE to save time, effort, and energy. And perform hand hygiene to remove bacteria, dirt, and other pathogenic microorganisms. Put on isolation gown and tie all ties and ask assistance from other healthcare personnel because isolation gowns will reduce the risk of contamination during exposure to patients with communicable contagious disease. Put on surgical cap and put on mask or N95 mask. Make sure to secure it properly behind the ears. It protects the nose and mouth from splatter of body fluids before inhaling it. Put on face shield or goggles. Face shield provides full face coverage. Goggles also provide excellent protection for eyes. Then put on gloves. Gloves should cover the cuff or wrist of gown. Protection and guards the hands from touching anything that may cause disease or harm to one's health. And healthcare may now enter the patient's room. Remove gloves. Ensure glove removal does not cause additional contamination of hands. Use glove in glove or bird technique to prevent spread of pathogenic microorganisms. Remove gown and tie all ties. Do so in gentle manner, avoiding a forceful movement. Reach up to the shoulders and carefully pull gown down and away from the body. Rolling the gown down is an acceptable approach. Dispose in trash receptacle to prevent further spread of harmful pathogens. And then perform hand hygiene to ensure safety and clean hands prior to touching the facial part. Remove face shield or goggles. Carefully remove face shield or goggles by grabbing the strap and pulling upward and away from head. Do not touch the front of face shield or goggles. Dispose properly to the designated container to prevent recontamination of clean hands. Remove and discard face mask. Do not touch the front of the face mask. Dispose properly in the designated waste bin to prevent the spread of harmful pathogens. Also remove the surgical cap. And last, perform hand hygiene again to ensure safety and clean hands.